Yes. There's a couple.
If you hop on, tell us where you're watching from. Hi, Heather.
Riley and Stacy.
And Becky.
There they are.
There we go.
Very good.
Okay. We have our very own Dr. Tony with us today. He's the Valley Vet Tech Service veterinarian, and he is going to talk about goats and sheep.
Please put any questions that you might have in the comments over there. At the end of this segment, we are going to be giving away 2 Valley Vet gift cards to 2 lucky viewers. So get your questions in there. And with that, we're going to turn it over to Dr. Tony.
Hi, folks. It's like we've got quite a variety of people today from all over the place. Do we have any questions to start out with? If not, then I can start talking about some topics. But if we have questions, that might be more helpful for people. No questions to start with? Okay. Well, a couple of things that we wanted to discuss today would be vaccines in our sheep and goats, and also dewormer and some deworming protocols. And so those are a lot of the questions that I get on the phones. And I see Sunny kind of put affordable and effective goat dewormer for barber pole. And I wish it was that simple. The problem with the barber pole worm, which is the most common parasite that our sheep and goats get, is the level of resistance. And so there are a lot of new recommendations that are coming out. And by new, I mean within the past 10 years or so. And we're trying to kind of change the way that we approach deworming in our sheep and our goats. And the biggest goal that we have is we want to diminish the numbers of worms to a level where it does not affect the health or the production of these animals. Our goal is not ever to completely get rid of the worms. It's not realistic. It's not possible. And if we attempt that, then we're just selecting for a high level of resistance. So what we want to do is we want to deworm the animals that are affected the most by these worms. There's a natural level of resistance that these animals have, natural level of immunity, and every animal is different in that level of immunity. Okay, and there's some methods of it. The best method is called FAMACHA, and it's a card that you use to look at the color of the eyelids on these. It's intended for sheep, but it can be used on goats as well. And you do this at an interval, and it varies from farm to farm for whatever's practical for your operation, and then also what you're finding as far as the worm load. You use this FAMACHA card and you deworm the animals that are more affected by the worms, and you don't deworm the animals that have a high level of natural immunity, and they suppress the levels of the parasites on their own. So this is best practice when we're talking about deworming sheep and goats. Okay. As far as what product to actually use, the current recommendation is that we use multiple products at one time. And multiple products need to be from different classes. So we've got classes like ivermectins. We've got classes like Safeguard and bendazoles that are going to be in the same class. And then our third class is going to be lefamizole. And so we want to use 2 or 3 of those classes at the same time when we deworm these animals. So that's kind of a brief overview. If you're interested in learning more about FAMACHA, there are some online certification courses to get those cards and get them ordered. And there's a lot of training material for FAMACHA on the internet. And I think it would give you a lot more information if you're interested in learning more about that. But I see we've got a lot of questions coming in. And so we're going to start addressing some of those.
The first one was about Floppy Kid Syndrome.
The first one was about Floppy Kid Syndrome. And that's a tough one. You know, it's one where we've got usually it's some nutritional deficiencies in these animals. And so we want to make sure we keep the ration to a level to support these ewes and these does so that they aren't getting, or so that they are passing along levels of nutrients that these does and kids need. So that's a tough one. Some selenium, vitamin E are important material or minerals for that.
There was a question about can CL be passed down to kids?
CL can be passed to kids, yes. The bacteria is very hardy in the environment, and so every time one of the animals gets an abscess that has those organisms in it and it ruptures and breaks, those bacteria can then live in the environment and be spread to open wounds and sores on kids and lambs. We do have a vaccine for it, labeled for sheep. We don't currently have one labeled for goats, but it is an effective vaccine. You could talk to your veterinarian about the practicality of vaccinating your goats with the sheep vaccine.
I hope I'm pronouncing this right. Coccidia Prevention?
Coccidia Prevention, yes. So the best practice for preventing coccidia is to put a coccidiostat into the feed or into the water, and Bovatec, Rumensin, or Decox, they're going to fit in those classes. And so talk to your nutritionist about trying to get that mixed into the ration. And you want that to be mixed in at a level that's going to be effective, and you want to make sure you get it in at an appropriate time. These kids are going to be most likely to get infected around 3 weeks. So you want to get that in before the does start kidding, and then you want to continue it to a point where you don't really have too much concern about picking it up, usually till about weaning time or a little after that.
Somebody asked about lice mite poron treatment,
Right.
And wondered if it was safe for late-term pregnancies. So maybe talk about that a little bit.
Okay, yeah, so lice poron treatment is safe in pregnancy. All of the products that we carry are, and we have a lot of different products. The one that's labeled for goats would be Ultra Boss Poron, and it's a very concentrated formulation, and so you put a small volume down the back, and it is effective. Whenever we're dealing with lice, I always recommend a retreatment in 3 weeks, and that gives us the best control that we can have. So.
There was a question on here. Somebody said that their vet recommended long range for goats, and he was worried about it. So I guess it was just.
Okay.
And he has milking Nubians.
Okay. Yeah, that's a prescription item, and so I'm not really able to provide guidance on that. So you would have to speak with your veterinarian about that. It requires a relationship with a veterinarian to look at your animals to talk about prescriptions.
Tina asked, is baking soda good for goats bloating?
Baking soda, so I think the reason that might be recommended in some places is a common cause of bloating would be acidosis. And that's when these goats and sheep load up on a lot of grain, and then they get acidotic in their rumen, and then that can lead to some bloating problems. So I wouldn't recommend it on a regular basis. I would really focus on your ration and your hay consumption, and that's going to be your best bet to try to prevent bloating.
Jennifer asked, what about the pellet style dewormers?
Pellet style dewormers are good choices if that's the most practical way to get it into them. We've got pellet wormers and Safeguard, and so those are effective ways to deworm.
At what age do you give CDT?
Good question. So we need to talk about vaccinating the does and the ewes. And so you really need to give your does and ewes a shot for CDT at 3 to 4 weeks prior to lambing and kidding. And this really helps support those young animals. Now, when we're talking about vaccinating the young animals, if the does and ewes are appropriately vaccinated, I don't recommend vaccination until about 6 to 8 weeks of age, followed with a booster 4 weeks later. If they're not vaccinated, the does and ewes, then you can vaccinate as early as 2 weeks of age. However, it's not as effective. It's a lot better to get vaccines into the does and ewes 3 to 4 weeks prior to lambing or kidding.
I'm not sure what Evelyn was, she asked.
Okay, and then so Evelyn followed it up with, do we give 2 different kinds at the same time? And I'm assuming she's talking about, that's a follow-up to the CDT question. And so a lot of the CDT products that we have are combination products. They have Clostridium perfringens C, D, and tetanus, and that's what CDT stands for.
We had a question about what to feed weathered goats.
What to feed weathered goats. I'm going to be honest, I'm not a nutritionist, and so I don't have a whole lot of information for you. If you want to get nutrition-specific information, I probably am not the best source for that. But, you know, just a high-quality hay is going to be important. That should make up the bulk of their diet. And then as they get further along in their pregnancy, then you need to start supplementing that with some concentrate or some higher energy feed to help support the fetus growth. So as far as specific products to use or specific ration formulations, I'm not going to be able to help too much with that.
Shannon,
Oh, sorry, go ahead.
Shannon said, we have a large flock of sheep, but I just got my first goat. Can you recommend a good diet versus the sheep? We feed our sheep on pasture, and maybe some tips for the first time goat owner.
Okay. Diet's going to be very similar between goats and sheep. If they're out grazing, they're going to have a little bit different grazing habits. But as far as feeding them with harvested feeds, it's going to be very similar. So just a good quality hay, and a lot of times that's all that they need. And if they can't maintain their body weight, then you can start to add some concentrates to help support that.
We had a question about the best age to de-wean a baby goat.
To wean a baby goat?
Wean.
To wean a baby goat?
Yes.
Okay. Typically, baby goats are weaned at about 60 to 90 days of age. And that would probably be best practice recommendations.
Jane asked, are you familiar with Microplasma in goats?
Yes, Mycoplasma in goats, it can present itself in multiple different ways. Commonly, it can cause some pneumonia issues. Commonly, it can cause some swollen joints in goats and sheep. And then it can also travel to the udder and cause some mastitis issues. We don't have a great vaccine for it. It's a difficult bug. It can lead to some chronic disease issues. If you've got Mycoplasma, it can be a struggle. But I typically recommend tetracyclines for treatment for that. But that might be something you want to get your veterinarian involved with if you think you have Mycoplasma on your property.
Can natural options, as in cedar trees, be helpful in preventing parasites?
I am not aware of any cedar tree benefit. I know there's a lot of natural remedies out there. There is one that is effective, and it's copper boluses, and this is for goats. I want to really say that do not give your sheep copper boluses because sheep cannot handle that. But for goats, you can give them copper boluses, and they last for up to 6 months, and they really help the goat naturally fight off those worms so that you hopefully don't have to deworm as high a proportion, and the ones that you do have to deworm, it really helps. It kind of acts as a synergist and helps those dewormers work better.
How often do copper bolus goats in
How often do you copper bolus goats? Yes, and so that about twice a year is what I would recommend for the copper boluses. Anne asks, is leaving free choice baking soda harmful? And it can be. The concern there is these rumen organisms, they're what digest our grass and our concentrates. They're bacteria, protozoa that are natural in that stomach of these goats and sheep. And they function at a very specific pH or acidity of the stomach. And depending on the diet, that changes. And so if we are changing the pH of that rumen by leaving out supplements, I worry that we could affect those organisms and affect the digestion of their feed stuff. So I don't know that I would necessarily recommend leaving free choice baking soda for bloat prevention.
You talked about vaccinating, correct?
Yeah, we talked about vaccinating. Kids and lambs.
When to start.
When to start, at what age. We did talk about that earlier. Amy asks about goat polio. Polio it's a thiamine deficiency. Usually it's because they're getting a high concentrate feed, and especially some of the concentrates that have higher sulfur levels is usually what causes polio. For those of you who aren't aware, polio is a neurological disease where these goats can be affected in several different ways. The treatment for it is injectable thiamine. If you catch it early enough, then it is a very effective treatment. But as far as preventing it, again, we go back to that. You really want to focus on a high forage diet for these goats and sheep.
What are symptoms of worms in goats? What should people look for?
Okay, symptoms of lungworms in goats. Lungworms, they really only happen in young goats. And so if we've got older weaned goats or adults that are coughing, 95% chance that it's not going to be lungworms. But if young goats are coughing and we're suspicious of lungworms, that would be the biggest sign of them is coughing. And those young, and we're talking 1 to 3 week old goats, is typically the age group that's affected. Ivermectin dewormers are going to be the most effective against those parasites in goats.
When should people band their bucklings? You might also talk about dehorning them. At what age?
Okay, good questions.
How many days?
So we'll start with the banding. Banding, there's a lot of opinions out there. And the reason that there's a lot of different opinions is because if we band too early, we can predispose them to urinary stones and getting obstructed. And so really, we probably want to wait as long as we can to band those bucklings. And that gives that urethra time to grow. And so that hopefully down the road, we don't have as many problems with urinary obstructions. So if you wait till about weaning time, that would probably be a good recommendation. So that you just maybe need to think about a little bit of pain control at that point. The bigger that we get, that would be the downside is we might have some more pain to deal with. And so some options for that, maybe talk with your veterinarian about some prescription options for pain control. As far as dehorning or disbudding, that's the best way to do it is when they're little bitty, when we're talking about 7 to 10 days old. We've got really effective disbudding irons, and you just burn around the little horn bud, and it's a very quick process. If we do it at an early age, it's really not very painful for them, and that's the best, most humane way to dehorn or disbud these goats at about 7 to 10 days of age.
Wendy said, what should ewes be vaccinated for prior to lambing? I use CDT, and this year added a vaccine for just pneumonia.
Yeah, good question, Wendy. So CDT, every goat sheep needs to be vaccinated for CDT, and their last dose needs to be 3 to 4 weeks prior to kidding or lambing. So if they've never had CDT before, you need to give 2 doses, 3 to 4 weeks apart. And like I said, that second dose needs to be 3 to 4 weeks prior. There's a lot of risk-based vaccines available for sheep and goats. Not all of them are necessary for everybody. We have vaccines for abortion. We have vaccines for sore mouth, and there's other ones. Pneumonia is not a bad idea. We have a Mannheimia pastorella vaccine labeled, and that can be effective. One vaccine that's gaining a lot of popularity among sheep and goats is called Endovac, and that's good protection against bacterial causes of pneumonia. It can also help protect against foot rot issues and pink eye issues. And so that might be a vaccine to consider. Other than that, if you have specific problems, then you can start to think about vaccinating for those problems. But as a rule, I don't recommend those for everybody.
Did you talk about how often to deworm?
How often deworming should be done. So as far as providing blanket recommendations, that's really not the recommendation anymore. You know, we used to say, that you vaccinate every month, every 2 months, depending on what the current opinion was. But we really don't follow that anymore. We had a big discussion early on about the FAMACHA card and best practices for deworming. And in that training for the FAMACHA, they will talk about the interval that you should look at those eyelids and deworm your goats and sheep. But it can be as often as every week or every other week, or if it's more practical for you, you can back that frequency off to whatever you need to make it work for your operation.
How often should you trim hooves on goats and sheep?
Yeah, good question. Good question. How often should we trim hooves in goats and sheep? And I think twice a year would be a guideline to go by on that. And if you stay on top of them, then that should be more than enough to keep those hooves well maintained. Jennifer asks, is it okay to give a CDT vaccination to a new goat if you have no history of them having it? And yes, it is. It is a very safe vaccine. If they've had it or if they've not had it, it won't matter. Go ahead and give them a vaccine and booster that in a few weeks. Okay, Regina asks, urinary problems, do I supplement even with medicated feed? If you have a problem with urinary calculi and urinary obstructions, then you need to get some nutritional guidance for that. And I know ammonium chloride is commonly used. I believe that's the ingredient that's commonly used to help prevent urinary calculi. It all goes back to your calcium to phosphorus ratio, and so that takes a lot of guidance from a nutritionist to help develop a ration to make sure that calcium to phosphorus ratio is where it needs to be.
Dental concerns to look at with goats or sheep?
Dental concerns with goats and sheep? Not really. They typically have very little problems with their dentition, so I wouldn't be too worried about that.
I think you talked about goat polio.
Suggestions for treating goat polio? Yes, and that would be injectable thiamine. And that's a prescription item, so you would have to speak with your veterinarian about that. Oftentimes, anti-inflammatory is recommended as well, a steroid or a non-steroidal anti-inflammatory. Okay, we're getting some more questions about vaccines. I think we did cover that. Besides CDT, when to copper bolus a goat, and we like to do that twice a year on a 6-month rotation. And then Rebecca says, we copper bolus but still have issues with fishtail. Any recommendations? They also have loose minerals. I guess I'm not familiar with fishtail. I'm not sure what that is. I don't know if that's a vernacular term for a disease or what that is. So if Rebecca, if you want to maybe clarify that in the comments somewhere, I can try to come back to that. Okay. Jennifer asks, how do you feel about putting goat with horses in the same field? And that's excellent. As long as your animals get together, don't have issues with aggression, interspecies aggression, that's great. A good thing about that is all of their parasites are different. So if a horse consumes goat parasites or vice versa, they'll die in the stomach. And so that could be a really effective way to kind of control your parasite load out on pasture. Okay, Ann says, I thought copper bolus was for copper. Yes, it serves as a supplemental source of copper for goats, which helps strengthen the immune system. And then it also directly kind of inhibits parasites. So you get kind of a dual purpose there. Regina asks, when should I give my kids their first dewormer? And that's a good question. We were talking about the Famotocard earlier, and that was a good point, Regina. It might be a good idea to have a schedule to deworm your baby goats because they are more susceptible to parasites. And so deworming them at about that 4 to 6 weeks of age, about when you give the CD&T vaccination to them, that would be a good first deworming. And then you could safely assume that you can vaccinate them then every 4 to 8 weeks on an interval until they're weaned or past weaning. Okay, Mandy asks, what is milk fever and the treatment for it? Good question. Milk fever is when these does and these ewes, lamb, they produce a lot of milk, which is very high in calcium. And the intent, the body was made to draw that calcium out of the bones. Sometimes that doesn't happen and it draws it out of the blood. And then it can be very low calcium levels in the blood. Calcium's responsible for our muscles to work. And so if our calcium levels get too low, then we can't use our muscles. And so that's what we'll see with milk fever is they're not able to stand, is the initial sign. And then it can progress from there and get much worse. The treatment is IV calcium or oral calcium. And if you're going to go IV, that's best done with the veterinarian's guidance because that can be very dangerous to IV calcium like that. Okay, so Ann asks, if you leave out baking soda free choice, can you just quit giving it with no issues? I have always read to leave free choice as they only consume it when needed. I am confused. Yes, you can just go ahead and discontinue it, and that won't cause any problems. Heather asks, should sweet feed be treated as a treat versus an everyday food for goats? I would lean towards using that more as a treat. If your goats need help maintaining body weight, and that's typically if they are really close to kidding, then you want to give them more food with sweet feed or other sources of concentrates, or even better quality hay as an alfalfa. But typically, unless they are late stages of pregnancy or nursing kids or lambs, goats and sheep don't need a high level of concentrate feed. And so they can get by mostly on a hay heavy or hay only diet. Okay, Amy asks, could you please share some hoof care best practices and overall hoof maintenance needs for goats? Yeah, so we touched on this briefly earlier. Twice a year would be a good interval to go ahead and trim these hooves. And it maybe goes beyond the scope of this video to give specific instructions, but there's a lot of instructional videos online about how to trim them. They're very helpful, and it's not very technical, and a lot of owners can do it themselves. But they use small shearing trimmers, I guess. They look like big scissors, and you just take off the overgrowth, and there's no rasping involved. It's just trimming off the overgrowth. And a lot of times that's really all you need to do at that 6-month interval. If you have some problems, like some foot rot issues or other issues, things don't look right when you're trimming them, then you can address those at that point, and get some veterinary advice on that. Okay, Sonny asks, would silver spray be okay post-disbudding? Yes, absolutely. You can put on some disinfectants or even some fly repellents after you disbud them to help prevent some of that minor infection. Okay, Stacy Johnson asks, I have found here is Delaware, it is hard to get vaccines and needles. Is that in every state? So there are different requirements between states as far as getting needles and syringes. I'm not aware of any vaccine restrictions state to state. And so, Stacy, I think, I guess I can't speak for other companies or businesses, but as far as I know, through Valley Vet Supply, you can order vaccines in Delaware. Now, some states require prescriptions or a veterinary approval to order needles and syringes. And I think the intent is with the opioid crisis, they're trying to minimize the impact there in their state. So without looking, I'm not sure if Delaware falls into that. I know New York requires a certificate of need, and there are some other ones. But no, not every state is like that. Most states actually don't require any kind of approval process to get needles and syringes. Okay, Amy Murray asks, is it better to drench goats or give them injectable ivermectin? Excellent question, Amy. I should have touched on this earlier, but drenches are by far the better choice. So that includes ivermectin, and then also Safeguard only comes in oral forms, and levamisole only comes in oral forms. So it is better to go ahead and use the drenches on these goats and sheep. Pam asks, how can you prevent hoof scald? Excuse me. So hoof scald is similar to hoof rot. It's caused by a bacteria, and it is almost always secondary to wet conditions. So the best prevention is to keep the environment dry. And I know sometimes, depending on the weather, that's not possible. But giving them spaces indoors or outside of the rain, mud, that's going to be important for preventing hoof scald. If that's not sufficient, we have hoof bath options and some zinc and copper mixes that we can put in these hoof baths. And you can put them in an area where goats and sheep have to walk through them on a weekly basis. And that helps disinfect that infection or that hoof scald, try to help clear it up and prevent it. Okay, when administering CDT, what is the risk of anaphylactic shock occurring? Overall, the risk is very low. So on a percentage, I don't have a specific one, but it is very low. If you have animals that are debilitated or sick, have a very heavy worm burden, the risk goes up. But overall, that would not be a huge concern in the back of my mind. Best treatment for tapeworms in goats. Now, we really don't have any products labeled for tapeworms in goats. So unfortunately, we really don't have an option other than extra label use. And my hands are kind of tied on talking about that. So it may require you to have a conversation with your veterinarian. So I wish I could give you some more information, but we don't have any tapeworm products that are labeled for goats. I will tell you the risk of being infected with tapeworms in goats is very low. So typically that's not a parasite that we're highly concerned about in our goats and our sheep. A sign for copper deficiency? Yeah, good question. A lot of it's non-specific, so it's not going to be very easy to pick up on. Maybe the most pathognomonic sign is going to be a scraggly hair coat or a discolored hair coat, but that doesn't always happen. Some other signs is decreased immune system function, maybe some anemia, decreased reproductive performance. So like I said, they're not going to be things that really stick out at you, but it is a very important nutrient. How do I prevent mange in my herd? Mange is typically lice in our livestock species, and the best way to treat that is going to be Ultra Boss. That's the pour-on that's labeled for goats. There are other ones that are labeled for sheep, but you can use that as a pour-on down the back, and that is a very effective treatment. I will recommend retreating in about 3 weeks to help prevent or to help treat the lice. As far as prevention, lice happen when it's cold, and that's because these animals will sponge together, and it spreads very readily that way. You could theoretically deworm or pour them, on a preventative basis, but that would be up to you if you wanted to do that. Okay, so Rebecca clarified from earlier, she had asked about fishtail. Fishtail is thinned or fanned out. It's typically due to copper deficiency and shows copper in color on a black goat's coat. Okay. Well, Rebecca, you taught me something today. I had never heard of fishtail before. And so it could be a symptom of a copper deficiency. I'll take your word on that one because like I said, I really don't know. But you are right that discoloration on some black hair coats is a common sign of copper deficiency. And so those copper boluses would help prevent that from happening in these goats. Rebecca says we have well water that is high in iron. Okay. Okay. The next one, good mid-price range home ultrasound machine. Yeah, that's a good question. I know it can be challenging. Oh, did we lose it?
Microphone.
Just
You can switch
microphone.
the camera.
Well, yeah, it looks like the camera.
Jumped off the right camera for some reason.
Are we back?
Are we back?
Sorry, guys. Okay, so we were going to talk about a good mid-priced home ultrasound machine. We have a unit called Preg Scan. That would be a good mid-priced machine, and that picks up on fluid in the uterus. Used appropriately, it can be very accurate, but there is a learning curve associated with that. And so it does take practice, and they come with detailed instructions, but that would probably be the one that I would recommend. There's no image to see. It just gives you indicators whether it's pregnant or not. Okay. And the next one. Shouldn't you only deworm with the fecal first to know what you are dealing with? That's a good question, Anne. So they've done a lot of work on deworming goats and sheep, and by and large, the main parasite that we deal with is the barber pole worm. And so it is safe to assume that that is going to be the only parasite that we need to really worry about in sheep and goats. And that's what the Mange tells us. The barber pole worm likes to eat a lot of the goats and sheep's blood. That's kind of graphic, but that's what it lives on. And so if we have a heavy load, then they get anemic, and the color of their eyelids starts to become pale. And so based on that color of their eyelids, then we can determine their worm load. Now, if you wanted to do fecals and fecal species, then there are avenues to do that. And that would not be a bad thing to do. It just may not be a recommendation we give for everybody. Okay, we're back again. All right, sorry about that, everybody.
There's testing.
Okay. Lee asks, if we give copper bolus, do we need to keep a mineral tub out for the goats? They have rotational pasture and good grass and weed hay. Yes, you still need to address the other trace minerals that the goats need. Copper is a very important one, but it's not the only one. So I would still recommend keeping trace minerals either loose or in a tub available. Okay, Riley asks, is dam raising or bottle feeding better for dairy goats? That is a good question. Typically, if we're dealing with dairy animals, you're going to bottle raise these youngsters. And the reason for that is just so that we can use that milk for, if we're making cheese or selling the milk as a product. I don't think there's any downside to bottle raising these youngsters. And so I think that would probably be the best way to go if you have a dairy operation. Any advice for tube feeding kids? Any advice for colostrum replacer usage? Is it better to find the highest amount of IgG in those colostrum replacers? It's something that doesn't get talked about enough. So tube feeding kids, it can be a challenge. And we do have some red tip catheters, I guess, that are available for tube feeding these kids. And I guess obviously the most worrisome thing that we can run into is putting it down into the lungs. And so we want to make sure we get it into the stomach and not into the lungs. When you're tubing these little kids, their esophagus that goes down into their stomach is on the left side. And so as we introduce that tube into the mouth, we want to make sure we do that on the left side. That gives us the best chance of that little kid swallowing it and it going into the appropriate place. I know there's in videos online, it's something that just takes some practice. If you put a small amount of just water into the tube first, if it's in the lungs, they're going to cough like crazy. And that's probably going to be the safest things to get into the lungs. It'd be a lot better than colostrum or milk replacer getting into the lungs. So if you're not sure or confident, maybe put a little bit of water in there first and see if that kid coughs or reacts in any way. And then go ahead and put your colostrum in there. As far as specific products, so she asks about IgG, and those are the antibodies in the colostrum. And obviously, the higher levels are better because that's what we're going after. We want to get those levels of antibodies into those youngsters. But as far as specific products, that can be a challenge. I know there's really not a lot of products that are labeled specifically for sheep and goats, so you may not have a wide selection. But go ahead and look at that IgG level and pick the best one that you can find. Okay, I've noticed my 1-month-old kids nurse like they are starving. Is this normal? I weighed my month-old boar buckling and he weighed 35 pounds. Is this on track? Yeah, that's definitely not a bad thing. The faster they grow, that's what we want. So as long as we aren't running into problems with bloating or diarrhea or issues like that, there's nothing wrong with them, really nursing a lot. What gauge needles do you recommend having on hand for various needs? Good question. When we're vaccinating our kids and lambs, I think a 20 gauge by 3/4 inch needle or 5/8 inch needle might be more appropriate for a subcutaneous injection. If we're giving thicker injections, like some prescription antibiotics, then probably an 18 gauge by 3/4 to 1 inch, depending on whether we're giving it subcutaneous or in the muscle. Okay, Heather asks, I adopted a goat that has overly grown hooves. Should I leave it or is it correctable? Yeah, I think you should attempt to trim them. If they're really bad, a lot of times it takes kind of a step-by-step approach. You're not going to get it back to a normal conformation with your first trim. That blood supply, that sensitive tissue grows out as the hoof grows out. And so you need to trim it back as close as you can and avoid getting into that sensitive tissue. And so if you're correcting issues like that, you need to do it on a more frequent basis than twice a year. Doing it every other month or every third month would be appropriate for that purpose. Getting a professional involved, whether it's a professional hoof trimmer or veterinarian, sometimes is necessary to get these really bad ones corrected. Okay, at what age should loose minerals be made available to bottle kids? I would say immediately. They're going to go ahead and they're going to start nibbling on stuff and leaving some good quality grass, hay or green grass available. They're going to start nibbling on that. The earlier we can get that rumen, that stomach working, the better. And it's not going to harm them at all. Should a copper bolus be swallowed? Is it okay if the goat accidentally chews it? Ideally, they're formulated to be swallowed whole. If we chew it, they may not last quite as long. So as you're administering that bolus, you want to get it into the back of the throat before you get it out of your bolus gun so that they can't chew that. Best way to test for mastitis at home? That's a good question, Mandy. And as far as a home test goes, I'm not aware if we have a mastitis test like we do in dairy cows for goats and sheep. And I'd have to do some looking to see if that California mastitis test was able to be mixed between species because I don't know that off the top of my head. Typically, if we have mastitis problems, the bag is going to get hard and it's going to get kind of warm to the feeling. And as we milk out the milk, it's going to be kind of clumpy. And so typically, that may be all we need to know is that something's not right. She's acting painful. She's kicking at the lamb or the kid when they try to nurse, or if they're dairy goats and we're stripping them to get them milked and we notice those clumps or the hardness in the bag, then we can safely assume that we've got mastitis. Okay, Nick asks, in our area, all the vets are working on small animals only. Oh, okay, it's not much of a question. Yeah, it stinks, Nick. I know I've heard a lot of reports about that.
You kind of answered that one. I don't know if you want to.
Okay, Danny asks if goats can be kept with horses, and then she kind of goes on to ask if there's any diseases that we should be worried about giving back and forth. And no, there's no diseases. So yes, I think that would be a good idea to keep those goats with horses. Okay.
About that one.
Are x-rays dangerous to late-term pregnant goats? Is there a good way to preg check nanny goats? X-rays, they're not really dangerous. They are a source of radiation. So theoretically, the possibility exists for causing some mutations, I guess, in the babies and causing some birth defects. But that's very low risk. Not very practical for a way to preg check more than one goat or something, but that would be an option. As far as preg checking the goats, we have the preg scan available that we mentioned earlier, or a lot of veterinarians have portable ultrasound units that they can use to preg check them. What is better for vitamin B? Fortified B, B gel, B complex, oral, or injectable? And that's a good question. B complexes are going to be the best. There's several different kinds of vitamin Bs, and a lot of them are going to be very similar. You're going to be sure to get the highest level into them if you give them injectable, but that's more of a treatment for injectable. And if you're just trying to supplement the diet, then oral B gels or complexes are going to be sufficient, and they're going to do a good job and get absorbed well. Okay, Jennifer asks, what should I give my goat that has an infection, and what would cause the goat to be fine and then 4 hours later have it die? It is not worms. That's a tough question without seeing the goat or examining the goat. There's lots of different diseases and things that can be going on there. So it's kind of hard to provide a recommendation on that. There's different prescription antibiotics that work well for goats and sheep. They're off label, and so they require a prescription from your veterinarian, some guidance there. So I will kind of defer on that question. Regina asks, how old does my buck need to be to breed my small herd? That's a good question. It depends on when your buck throat goes through maturity, sexual maturity, and there's guidelines. Every animal's different, but about 6 months of age is typically what I recommend for waiting to turn them into breeding adults. Okay, what to give a goat with a stuffy nose? Typically, a stuffy nose is a respiratory issue, and so there are some over-the-counter antibiotics that might be appropriate, and there are some other prescription antibiotics that could be appropriate. So on the guidance of your vet, I'm kind of walking a tight line. I can't really give a whole lot of extra label advice here because that does require a valid veterinarian relationship. So how contagious is Listeria between goats? And it's really not. Typically, it's something they pick up in the diet or from the environment, and it's not really spread between goats in the classic sense. All right, Annette asks, can barber pole be helped with a product called Biowerma with Livamol? I don't know. I'm not familiar with that product. Annette, do you know what the ingredients are in the product? No? Okay. Well, if you want some clarification on that, Annette, leave your email address in the comments, okay? And I will look that up and I will contact you because I don't know. I really don't know the answer to that because I don't know what the product is. Mandy asks, I keep my newborn separate from my horses, cows for a short time so they are able to get out of the way. Okay. And then Connie asks, what product is good to give a goat to gain weight? That's a good question. So if we're trying to get our goats to gain weight, we want to give some concentrate supplements. Calf manna is a really good supplement, high protein, high energy level. And so that would be a good product to give, or just some corn, soybean rations, like a goat ration that you can get from the feed store. Would be some good choices to supplement your hay. So, and then Pam asks what the best age to band a billy goat. We kind of discussed that earlier. So Pam, I might refer you back to that, but very briefly, we do want to kind of try to wait as long as we can to give them a chance to grow, and then we go ahead and band them around weaning time. But we did speak a little bit more in depth about it earlier. Okay, so somebody clarified, Biowerma is a fungus that eats barber pole larvae. Okay. Well, I mean, it sounds like it has possibility to be effective, but I don't have any specific use or experience with it. So I don't have a whole lot of clarification if it's going to work well or not. Okay. All right. Well, thanks, guys.
That was great. If
Thank
you guys
you.
have any more questions, just go ahead and leave them in the comments and we'll have Dr. Tony.
Yeah, and if you guys have any issues or need any help, I am available here by telephone. So call us and ask for technical service, and I'd be happy to help you choose vaccines or talk about any questions you might have.
Awesome.
Okay,
Thank
thanks,
you,
guys.
Dr. Tony.
Thank you very much.
Okay, be sure to check out valleyvet.com for all of your goat and sheep supplies. We have everything you need in one place: wormers, vaccines, supplements, equipment, hoof care, and lots more. So check us out. All right, we have a couple of winners.
Yeah, we're going to draw the winners before we make our last little thing. So, the two winners that we have are Shannon Burden and Riley Henning.
Congratulations, Shannon and Riley.
All right.
Hey.
And before we hop off here, we wanted to remind you guys that our Spray Master Spectacular giveaway is going on now. It will be going on until June 24th. So get signed up.
Make sure you follow us on social, and you'll be some of the first to know about all of our live video schedule, and sign up for emails so you know about all the latest sales and promotions. And join us next Wednesday, February 23rd. We are going to be live with Stephanie from Carday Martin, and we're going to be talking about how we can make grooming easier this spring. So you won't want to miss that.
All right.
And that's all. See y'all next Wednesday.
Let's see if I can get this. See y'all later.